This is the first video of a four-part series on usability, starting with an introduction. The other three parts include basic concepts, real-world applications, and the disciplines behind usability. Why usability? Why should you care about it? And what does it have to do with healthcare IT? Everyone has either personally had an experience like this with technology or knows someone that gets frustrated by it. Perhaps some did not use computers for most of their lives, but then were forced to learn later in life. On the other hand, people that have grown up with technology may quickly realize when something feels clunky or doesn't make sense. However, the feeling of frustration and perhaps anger at poorly designed technology is universal and is the focus of usability. Here's a definition per HIMSS, the Healthcare Information and Management Systems Society. UI stands for user interface, and UX stands for user experience. When you combine the two, you get usability. It is the effectiveness, efficiency, and satisfaction that allows you to perform necessary tasks quickly, efficiently, and with a minimum of mental effort. Focusing in on the user interface, design is closely tied with usability and determines the experience someone has. The top left picture is the remodeled version of the kitchen in the bottom right. Although these are pictures of a kitchen, the same design principles apply to healthcare IT. Usability has to be addressed over time with any changes, since swapping out an appliance may change the flow. For example, the door on the refrigerator may get in the way if it isn't planned out before buying one. But technology is not restricted to physical objects. The equivalent of a complete kitchen remodel can seemingly happen overnight, such as when upgrading from one Windows version to another. When we focus on user experience, the experience across different countries is consistent for traffic stop signs, which translates to a better experience. If countries did not coordinate internationally, then it would be much more difficult to adjust to driving in other countries and thus result in more motor vehicle accidents. As you can see, making sure that they all have the same hexagonal shape, red background, and white lettering precludes the need to understand different languages. A user interface is like a joke. A lot of work goes into a good joke, and great comedians know their audience and immediately tailor jokes according to how they respond. Stand-up comedy requires this skill, since there are different cultures and experiences that people relate to and find funny. Another way to look at usability is compare MVP versus MLP. That is a minimum viable product or a minimum lovable product. Minimal viable products will get the job done, but may exclude the user experience component. Minimum lovable products make sure to take the user experience into account so that it's easy and enjoyable to complete tasks. However, it does take a lot of time, effort, and resources to boost user experience and usability, which slows down time to market. Companies will need to find the right balance between their resources versus what they can actually bring to market. When we look at Android and Apple, what happens when a lifelong Android user picks up an iPhone? Or vice versa, what happens when a lifelong Apple user picks up an Android phone? It takes considerably less effort to accomplish the same tasks on your own phone. And that's because you put in multiple hours, and companies have put a lot of work into consistency in look and feel across phones, tablets, laptops, and computers. Another aspect of usability is understanding your audience. One example is drug information websites. Since it must accommodate the needs of everyone, there are choices that help anyone get the most value from the information in the site. So depending if you're a patient, a healthcare provider, or a research scientist, there's a clear way to get to what you most likely need quickly and in terminology that matches your background training. This format of providing audience-specific choices on medication websites has been standardized by regulatory agencies to improve the flow of information. Moving on to a hypothetical example, suppose a physician places an order for fentanyl 20 micrograms. Assuming that the automated dispensing cabinet, or ADC, is not integrated with an electronic medical record, the nurse is then presented with these two options when trying to obtain the medication from the ADC. When presented this way, it will make a 100-fold overdose more likely. There are a few factors at play here. The design with the red text draws your eyes to it, whereas the small black font below the red text is harder to notice. So usability heuristics come into play here. With that, thank you for listening to this introduction to usability, and hopefully it highlights why it is an important aspect of healthcare IT.